Skin cancer. The best treatment options. Skin cancers are cancers that arise from the skin. They are due to the development of abnormal cells that have the ability to invade or spread to other parts of the body. There are three main types: basal cell skin cancer, BCC, squamous cell skin cancer, SCC, and melanoma. The first two together, along with a number of less common skin cancers, are known as non-melanoma skin cancer, NMSC. Basal cell cancer grows slowly and can damage the tissue around it but is unlikely to spread to distant areas or result in death. It often appears as a painless raised area of skin, that may be shiny with small blood vessel running over it, or may present as a raised area with an ulcer. Squamous cell cancer is more likely to spread. It usually presents as a hard lump with a scaly top but may also form an ulcer. Melanomas are the most aggressive. Signs include a mole that has changed in size, shape, color, has irregular edges, has more than one color, is itchy or bleeds. Greater than 90% of cases are caused by exposure to ultraviolet radiation from the sun. This exposure increases the risk of all three main types of skin cancer. Exposure has increased partly due to a thinner ozone layer. Tanning beds are becoming another common source of ultraviolet radiation. For melanomas and basal cell cancers, exposure during childhood is particularly harmful. For squamous cell cancers, total exposure, irrespective of when it occurs, is more important. Between 20% and 30% of melanomas develop from moles. People with light skin are at higher risk, as are those with poor immune function, such as from medications or HIV/AIDS. Diagnosis is by biopsy. Decreasing exposure to ultraviolet radiation and the use of sunscreen appear to be effective methods of preventing melanoma and squamous cell cancer. It is not clear if sunscreen affects the risk of basal cell cancer. Non-melanoma skin cancer is usually curable. Treatment is generally by surgical removal but may less commonly involve radiation therapy or topical medications such as fluorouracil. Treatment of melanoma may involve some combination of surgery, chemotherapy, radiation therapy, and targeted therapy. In those people whose disease has spread to other areas of their bodies, palliative care may be used to improve quality of life. Melanoma has one of the higher survival rates among cancers, with over 86% of people in the UK and more than 90% in the United States surviving more than 5 years. Skin cancer is the most common form of cancer, globally accounting for at least 40% of cases. Ultraviolet radiation from sun exposure is the primary cause of skin cancer. Other factors that play a role include smoking tobacco. HPV infections increase the risk of squamous cell carcinoma. Some genetic syndromes, including congenital melanocytic nevi syndrome, which is characterized by the presence of nevi, birthmarks or moles, of varying size which are either present at birth, or appear within 6 months of birth. Nevi larger than 20 mm, 3/4 of an inch, in size are at higher risk for becoming cancerous. Chronic non-healing wounds. These are called Marjolin's ulcers based on their appearance, and can develop into squamous cell carcinoma. Ionizing radiation, environmental carcinogens, artificial UV radiation, for example tanning beds, aging, and light skin color. It is believed that tanning beds are the cause of hundreds of thousands of basal and squamous cell carcinomas. The World Health Organization now places people who use artificial tanning beds in its highest risk category for skin cancer. The use of many immunosuppressive medications increases the risk of skin cancer. Cyclosporin A, a calcineurin inhibitor for example, increases the risk approximately 200 times, and azathioprine about 60 times. Currently, surgical excision is the most common form of treatment for skin cancers. The goal of reconstructive surgery is restoration of normal appearance and function. The choice of technique in reconstruction is dictated by the size and location of the defect. Excision and reconstruction of facial skin cancers is generally more challenging due to presence of highly visible and functional anatomic structures in the face. When skin defects are small in size, most can be repaired with simple repair where skin edges are approximated and closed with sutures. This will result in a linear scar. If the repair is made along a natural skin fold or wrinkle line, the scar will be hardly visible. Larger defects may require repair with a skin graft, local skin flap, pedicled skin flap, or a microvascular free flap. Skin grafts and local skin flaps are by far more common than the other listed choices. Skin grafting is patching of a defect with skin that is removed from another site in the body. The skin graft is sutured to the edges of the defect, and a bolster dressing is placed atop the graft for 7 to 10 days, to immobilize the graft as it heals in place. There are two forms of skin grafting, split thickness and full thickness. In a split thickness skin graft, a shaver is used to shave a layer of skin from the abdomen or thigh. The donor site regenerates skin and heals over a period of 2 weeks. In a full thickness skin graft, a segment of skin is totally removed and the donor site needs to be sutured closed. Split thickness grafts can be used to repair larger defects, but the grafts are inferior in their cosmetic appearance. Full thickness skin grafts are more acceptable cosmetically. However, full thickness grafts can only be used for small or moderate size defects. Local skin flaps are a method of closing defects with tissue that closely matches the defect in color and quality. Skin from the periphery of the defect site is mobilized and repositioned to fill the deficit. Various forms of local flaps can be designed to minimize disruption to surrounding tissues and maximize cosmetic outcome of the reconstruction. Pedicled skin flaps are a method of transferring skin with an intact blood supply from a nearby region of the body. An example of such reconstruction is a pedicled forehead flap for repair of a large nasal skin defect. Once the flap develops a source of blood supply from its new bed, the vascular pedicle can be detached. In cancer care, different types of doctors often work together to create a patient's overall treatment plan that combines different types of treatments. This is called a multidisciplinary team. Cancer care teams also include a variety of other healthcare professionals, including physician assistants, nurses, social workers, pharmacists, counselors, dietitians, and others. Descriptions of the most common treatment options for non-melanoma skin cancer are listed below. Treatment options and recommendations depend on several factors, including the size and location of the skin cancer, possible side effects, and the patient's preferences and overall health. Your care plan may also include treatment for symptoms and side effects, an important part of cancer care. Take time to learn about all of your treatment options and be sure to ask questions about things that are unclear. Also, talk about the goals of each treatment with your doctor and what you can expect while receiving the treatment. Cancer and its treatment often cause side effects. In addition to treatment to slow, stop, or eliminate the cancer, an important part of cancer care is relieving a person's symptoms and side effects. This approach is called palliative or supportive care, and it includes supporting the patient with his or her physical, emotional, and social needs. Palliative care is any treatment that focuses on reducing symptoms, improving quality of life, and supporting patients and their families. Any person, regardless of age or type and stage of cancer, may receive palliative care. It works best when palliative care is started as early as needed in the cancer treatment process. People often receive treatment for the cancer and treatment to ease side effects at the same time. In fact, patients who receive both often have less severe symptoms, better quality of life, and report they are more satisfied with treatment. Palliative treatments vary widely and often include medication, nutritional changes, relaxation techniques, emotional support, and other therapies. You may also receive palliative treatments similar to those meant to eliminate the cancer, such as topical medications, surgery, or radiation therapy. Talk with your doctor about the goals of each treatment in your treatment plan. Before treatment begins, talk with your healthcare team about the possible side effects of your specific treatment plan and palliative care options. And during and after treatment, be sure to tell your doctor or another healthcare team member if you are experiencing a problem so it can be addressed as quickly as possible.